Hi everyone, and welcome to another informational video from your pre-health ambassadors. In this video, Kelly, Sydney, and I will be talking about some of the experiences we have had that helped shape us as pre-health students. To give a brief introduction of myself, my name is Julia Santini, and I'm a current senior at URI. I'm on the pre-med track, and I'm majoring in biology, sociology, and Italian, and I'm participating in the honors program. One of the most valuable experiences I have had outside of the classroom has been shadowing at my local doctor's office. The physician that I shadowed is an internal medicine doctor, and basically what that looked like was she was kind enough to let me follow her around her office once a week over the summer. And this was just to get a sense of what her day was like and the types of cases that she would see regularly. This taught me that even though it might not be the most glamorous, I think I'd love to work in primary care. So shadowing can be super important for pre-health students interested in many different pathways because it simply gives you an idea of what that person's day is like and the types of things that they see and what their work is. Another outside of the classroom activity that I participated in was alternative spring break. And this is a student-led and run organization at URI, and typically we run week-long service trips in Rhode Island and around the country and the world. However, obviously in the era of COVID, that isn't exactly possible. However, this year they are running weekend trips and other alternative forms of service. But being a part of ASB really gave me an appreciation for service, and it broadened my passion for learning from and serving with people whose lives can be very different from my own. I went on one service trip to Antigua, Guatemala, and another one to Laredo, Texas, and both of them were incredible learning experiences for me, and I made some great new friends. So there are also many other ways to get involved in service outside of alternative spring break, and that can look like joining the Habitat for Humanity Club at URI, or just getting involved in your local Habitat for Humanity office, or you can volunteer at a hospital or another clinical setting. I have done this, and I believe Sydney is going to talk about this a bit more in a minute. So with that said, I'm going to hand it over to Sydney, who's going to tell you some more about her experiences.
All right, thanks, Julia. So my name is Sydney Raymond. I'm a senior pre-med and I major in psychology, and I also participate in the honors program. Today, I'm going to discuss a few experiences that I have gotten to be a part of while being a student at URI. First off, I volunteered at Miriam Hospital for 100 hours. For anybody who's not a Rhode Island native, Miriam Hospital is in Providence, Rhode Island. During my time at Miriam, I worked in the transport department. So in this department, they had both paid and volunteer employees, but the paid employees were certified to work with patients that were being transported in beds to MRI, things like that. Volunteers could not do that. So in this department, I was able to have some minimal patient contact doing discharges. I also spent time doing specimen runs, blood and plasma runs, and I also performed other transport-related duties, such as grabbing specimen from the ER that needed to get stat ran, things like that. I found the time at Miriam gave me a lot of insight as to who was working in the hospital, because for the most part, you don't get to see everyone that's actually working in the hospital. It also gave me some insight as to the dynamics between the different providers in the hospital, nurses, doctors, even the laundry staff, which are way more important than people seem to care about. And it also gave me a lot of direct time with patients, not necessarily moving them during their time in the hospital, but I got to hear their stories, why they were in the hospital. A lot of them tried to give me advice. Some of them were doctors, some of them were people in healthcare. So they gave me a lot of advice and words of wisdom. So in addition to working at Miriam Hospital, I also did a lot of research with the kinesiology department at URI. Most of the work that I've gotten to do thus far is mainly data entry, but I've also gotten a lot of one-on-one conversation with the professor running the research project regarding the findings and the trends in the data. I found this experience the URI Pre-Health Experience Night. While this year we probably won't be able to host it just because of the COVID-19 precautions, but you can still find similar experiences through different means. Personally, I would suggest simply approaching your professors that you know have research projects that you're interested in, and show them that you're interested in working in the lab or just being part of what they're doing. The worst that they're going to say is no. So before I hand it over to Kelly, I want to point out that in the current climate, it may be hard to find clinical experience. A lot of hospitals suspended their volunteer shadowing programs, so I suggest looking for more remote volunteering opportunities. For example, I know the psychology department recently just sent out an email regarding Day One, which is a helpline for sexual assault, abuse, and hate crimes. They're currently offering a remote volunteering program where you can work as a helpline call operator. So that while it's not in a hospital, it's still some type of volunteering. You're still making some type of impact on the world. Additionally, many social media programs such as Instagram are starting to host virtual shadowing programs. Some easy ways to find this would include simply searching pre-health virtual shadowing programs, and they'll come up. I know I personally watched a few of them, and then you take a little quiz at the end and you're given credit for it. While there's no saying whether or not medical schools are taking this as shadowing hours, it's still a good experience for you to have to actually see what's going on in the hospitals. So with that being said, I'm going to hand it over to Kelly.
Hi everyone, my name is Kelly McDonald and I'm currently a fifth year on the PA track. I finished my first degree in kinesiology and am currently pursuing my second degree in writing while finishing up some additional classes for PA school. So I'm going to talk about my experiences within the healthcare field that I was able to have. So right now, I am currently a medical scribe in the emergency department at Westchester Medical Center in Valhalla, New York. I am a New York native, so this is my job back home. As a scribe, it is my job to write the doctors, physician's assistants, and nurse practitioners' notes as they assess patients that come in to the emergency department. This hospital is a level 1 trauma hospital, meaning we receive patients that have been severely hurt. On a typical day in the emergency room, I can see someone come in for something as small as a toothache, or I can see patients that have been in a 5-car pileup. It truly depends on the day. This experience has truly changed my outlook on healthcare and how imperative it is to be an efficient provider. Being a scribe and working in the emergency department has not only taught me skills such as time management and working under pressure, but it has continued to teach me compassion and how important quality of care is when working with patients. As far as this experience, I found this experience through Indeed, and that's where I applied was through Indeed. I work for Envision Healthcare, but I know that there are other scribe companies such as Scribe America. So this is also a great way to get some hours. Secondly, I have been a TA for the past 2 years for exercise physiology at URI. As a TA, it is my duty to assist the professor throughout the course of the semester, grade students' assignments, and hold my own office hours for the class. I was able to become a TA after I took exercise physiology my junior year in the fall. And after I took that, I reached out to the professor at the end of the semester and asked her if I'd be able to TA for the class going forward. And ever since junior year, spring semester, I've been a TA for that class. I love being a TA because it allows me to be a mentor to my peers, and it continues to expand my knowledge in the healthcare realm. This is another great opportunity that I have continued to have as a student here at URI. With all that being said, thank you for listening to us today, and we hope that the rest of the semester continues to treat you guys well. Please do not hesitate to reach out to any of the pre-health ambassadors if you have any other questions.